Every day, approximately 1 million Americans are treated by physical therapists. In hospitals, clinics, health agencies, and private practices across the nation, physical therapists help people with injuries or illness improve their movement and manage their pain. But is all physical therapy created equal? Many in the industry say no. Today's often used approach on focusing on just the symptoms or localized injury is robbing many patients of a true recovery and, in fact, putting them at risk for reoccurring and new injuries. A more comprehensive total body approach to treatment is what's frequently missing in the field of physical therapy today, according to experts like Anita Davidson.
If clinically we're only looking at a particular area of injury, frequently that area of injury is not actually the cause of the problem. Most often the cause of the problem can be somewhere else throughout the kinetic chain, whether it's from the foot, whether it's all the way up to the head. So the fact that your knee hurts may or may not have as much to do with the knee as it does with the back or with the foot or the core muscles. If we don't identify the cause of the problem or the injury, short of a traumatic injury that's happened, if we don't identify that cause, then we're setting the patient up to potentially have more injuries in the future or to have another part of the body be overused or overworn as a result of not addressing the cause of the symptoms at the time.
This symptom-first focus is further complicated by the common practice of double and triple booking therapy patients, which significantly reduces the ability of a therapist to focus on the patient and the unique issues associated with the injury.
With the increased expectation of therapists to treat multiple patients within a set time frame, there's less time for the therapist to be able to really identify what the cause of the problem is versus treating the symptoms. So it's easier to treat the patient as a single entity, so if the injury is with the knee, to focus in on the knee as opposed to looking at the cause for why that knee injury occurred.
When Anita Davidson decided to start her own physical therapy practice, she knew she wanted to treat her patients differently. She envisioned a comprehensive total body approach that provides not just injury treatment, but complete health and wellness through education, exercise, and sport.
Our practice focuses on the total body. We want to identify what the cause of the issue is that led to the injury, as well as look at all of the remediation that needs to happen to not only affect the pain and the dysfunction that's currently presenting, but also to look at future prevention.
Today, Creative Rehab provides services at its 2 state-of-the-art clinics, including sports or work injuries, post-surgical rehab, cancer rehab, pediatric care, vestibular rehab, aquatic therapy, massage therapy, as well as unique programs such as sports conditioning, transitions golf, the running program, ACL risk reduction, and the Dancer Answer. All of the programs at Creative Rehab have been designed by licensed physical therapists and specifically work to heal, prevent further injury, and provide education to achieve optimal outcomes for each and every patient.
Our sports conditioning program is designed to assist athletes of all ages, from the very young club athlete to the older adult athlete that is the occasional golfer. We really work to focus on what are the issues that they might be limited in as far as flexibility, mobility, looking at the 3 planes of motion again to assist in the functionality of what it is that they're trying to do in their sport. If we can prevent injuries before they happen, then that can set the athlete up for a longer term of success and reduce the long-term medical effects and loss of time from their sport.
The Dancer Answer is a program that's designed specifically to be a health resource for dancers. Dancers face very high-level and unique demands to be successful in what they do, and dance classes aren't always enough to keep them healthy. The primary service that the Dancer Answer provides is physical therapy, and in physical therapy we utilize a whole body treatment approach so that we're really making sure that we get to the underlying cause of what's going on for the dancer, so either their pain or their injury or their problem with movement. The other key point of the Dancer Answer program is education, and we do that during treatment with dancers and also preventatively. So sometimes we present to dancers, to parents and teachers in studios or in the clinic to give them the information they need to stay healthy.
Patients like Michael Summerling and Annie Snow came to Creative Rehab for different reasons, but both wanted to recover from injury and get back to doing what they love. Anita and her team helped give them the tools to do just that.
I'm an avid runner and I love doing triathlons in my spare time. However, the past couple of years I've been experiencing lower back problems. I saw a back specialist and he told me basically the only way to cure it was a slight bulging disc, and the only way to cure it was to either have surgery or possibly physical therapy. I knew Anita, we sat down, talked. She felt it was more in my frontal psoas muscles, the problem, and felt that through a regimen of stretching and exercises on my core, we could alleviate the pain in my back. Through doing it for 4 months, a hard regimen, and keeping at it, I was able to basically be pain-free in my back, which was just totally amazing to me. I've been able to run faster. I'm 55 years old, and my triathlon season last year was my best ever after receiving treatments from Anita.
Well, I'm a dancer, and I had sustained a hip injury while dancing, and I came to Creative Rehab because they had a program that specialized in physical therapy for dancers. My physical therapist gave me at-home exercises to do that were especially designed to help me strengthen the injury that I had, and I understood what was happening, and I was able to take the exercises that I was given and practice, do them at home in order to get better. The most beneficial component was the fact that I had one-on-one attention from my therapist, and I felt like I had her support and her interest in my well-being as I was healing.
At Creative Rehab, the belief is that you don't have to be in pain to do what you love. To that end, Anita and her team plan to continue to stand firm in their commitment to provide the very best in physical therapy care through extensive education, customized treatment, and excellent outcomes, with the ultimate goal of impacting how physical therapy is administered across the nation.
I feel very strongly that identifying the cause of problems related to medical issues is very critical for long-term health and wellness. If patients understand what the cause and effect components are of their care, they are more apt to make choices that allow for them to have long-term participation in their care and to be able to take charge of their health care. In order to educate patients, we really work one-on-one with the patients that we see. We participate in community education programs. We use multimedia, social media efforts to try to educate patients on issues related to injury prevention, but also identifying the cause of potential problems to assist with their health and wellness.
Creative Rehab, Center for Sports, Wellness, and Rehab. To find out more, please visit creativerehab.net.